This is a case of a patient who coughed up giant lung-shaped blood clot. A 36-year-old man was admitted to the intensive care unit with an acute exacerbation of chronic heart failure. His medical history included heart failure with an ejection fraction of 20%, bioprosthetic aortic valve replacement for bicuspid aortic stenosis, endovascular stenting of an aortic aneurysm, and placement of a permanent pacemaker for complete heart block. Ventricular assist device was placed for management of acute heart failure, and a continuous heparin infusion was initiated for systemic anticoagulation. During the next week, the patient had episodes of small volume hemoptysis, increasing respiratory distress, and increasing use of supplemental oxygen. During an extreme bout of coughing, the patient spontaneously expectorated an intact cast of the right bronchial tree. He coughed up a giant blood clot in the shape of his lung. The right bronchial tree consists of 3 segmental branches in the upper lobe, 2 segmental branches in the middle lobe, and 5 segmental branches in the lower lobe. The patient was extubated 2 days later and had no further episodes of hemoptysis. 1 week after extubation, he died from complications of heart failure despite placement of the ventricular assist device.